All right, so we're here with Andrew. Andrew had an ACL tear roughly about 4 months ago. Playing soccer, correct? We did a full ACL reconstruction. Right now he's 3.5 months out from the surgery. What's the latest that you've been doing in physical therapy at your 3-month mark?
Lunges, walking on the treadmill. Feeling really good. Leg raises.
Okay.
Squats.
The most important thing to recover after an ACL is full range of motion. If you check both his knees, the most important thing is that the knee is straight. We confirm that when you stick the hand underneath and you tell the patient to do a quad, tighten your quad, you should feel that pressure on your palm. That means that's a good test that the knee is flat. We would like to see flexion. Bend the knee. Okay, full knee flexion compared to the other side. We try to attain 130 degrees, but the most important thing is that it's symmetrical with the other side. And then perhaps the most important test to check for stability, I put my thigh underneath his thigh so I can relax his knee, and then I kind of crank the femur here, and then I do a shock motion to check the ligament stability. If there's no movement here, we can assess that the knee is really stable. Let me see you stand up. And then at this stage, I want to check. So if you notice, some patients at this stage, because the quad is not completely strong at the 3.5 month mark, they tend to lean a little bit towards the uninjured. The goal of the next phase of the rehab is to work on the quad strength, so ultimately they can balance the weight, distribute the weight symmetrical in both legs. And I want to test the balance, so stand on your right leg and do a single leg squat. You're gonna see a lot of shakiness. Come back up compared to the other side. There's not as much shakiness. That is a test that the quad is still firing up. When you go down on the single leg squat and there's a lot of shakiness, that means that the quad is trying to activate all those fibers that are asleep. There are studies that show that the quad after an ACL doesn't completely activate until after 6 months out. The next 3 months pretty much is strength and conditioning. You can do it at your own pace, at the gym, learn what you've taken from physical therapy. Do that for the second trimester, the next 3 months. I'll see you back here in 6 months. That's when we can start doing our return to sport testing. Okay?
Sounds good.
How's it feel, the knee?
Yeah, feels good. No pain, unless like I'm really kind of stressing it. But yeah, all good.
Now is time to get back to normal.
Okay.
The only thing that you shouldn't do, you can run outside so long as it's inline. Don't do any cutting, pivoting, box jumpers, jump landing, cutting, pivoting, decelerating.
No, like high impact kind of things.
Correct. Anything that requires for you to stop and go, can do that. Box jumps, like landing, squat, try to avoid those.
Yeah.
Bicycle, swimming, elliptical, treadmill, it's your best friend right now.
Sounds good.
All right. Cool.
Awesome.
All right.
Thanks.
So I'll give you your next appointment.
Bueno, sí.